Dr. Lee, thank you so much for joining us today and taking time out of your busy day to talk about bladder cancer. Can you tell me a little bit about yourself, where you're from, and why you went into cancer?
I'm one of the urological oncologists here at Roswell Park. I'm originally come from China, and then I came here for a research study for cancer research. Then I started the urology residency at Medical College of Georgia, did the urological oncology at Memorial Sloan Kettering, and I joined Roswell Park in 2017. My main focus is bladder cancer research. And, my main focus is bladder cancer surgery and bladder cancer research.
Dr. Lee, could you tell us what is bladder cancer exactly?
Bladder cancer is a cancer, what we call urothelial cancer. It's a cancer start from the lining of the bladder. It could divided in two groups. It could be a non-muscle invasive cancer, the cancer without deep roots, or the cancer with deep roots, what we call muscle invasive bladder cancer.
Are there signs and symptoms of bladder cancer that people should be aware of?
Yeah, the most common findings or signs or symptoms are actually painless gross hematuria, means you pee blood without any burning or pain.
And is there a screening process for bladder cancer? Is there a way to prevent it?
Typically, when folks go to the primary doctor typically will do annual urine analysis, checking blood in the urine, any blood cells in the urine. If they found red blood cells in the urine, and they will send the patients to urologists for screening. And typically what we do at that time is what we call hematuria workup, including get a CT urogram, and it's a dedicated CT scan. And they'll give folks the contrast and wait 15, 20 minutes and let the dye light up the urinary system looking for any polyps or any lesions. The second component is we will do a cystoscopy, which is a telescope goes in through the urethra. The channel connects to the bladder, and then we'll look inside the urethra and bladder. And this is how we diagnose the bladder cancer. The third component we often do is what we call cytology. It's literally a pap smear of the urine. So they'll spin down the cells in the urine and look under microscope looking for any cancer cells.
How is bladder cancer typically treated?
There are two groups of bladder cancer. The first is non-muscle invasive bladder cancer. Those are cancer cells that not invading to the muscle. The main treatment for non-muscle invasive bladder cancer is what we call TURBT. It's transurethral resection of bladder tumor. Basically, we scrape the polyp-like lesion, and typically we will follow the pathology, confirm it's not muscle invasive, then followed by bladder washing.
What are you hopeful for in research what is exciting right now for you in the research that you're doing at Roswell Park?
The way we're treating bladder cancer is different than we treated even 5 years ago, 3 years ago. There were multiple novel drugs are recently approved by the FDA. The first is immunotherapy, and those are the treatment we have seen very excellent response for the immunotherapy. The second is the targeted therapy. Those are recently approved just a year ago. This is a novel drugs. The other part from surgical side is that we do robotic assisted radical cystectomy instead of traditional open surgery. The surgery will be done minimal invasive with much smaller incision, less pain, less blood loss, with almost identical outcome as the open surgery.
Tremendous progress over the last few years then. That's wonderful.
Absolutely, absolutely.
How important are research dollars that you receive from community, fundraisers and events like the 11-day power play?
It's very important. Bladder cancer has been very, very understudied, underfunded. Despite the fact bladder cancer is the most expensive cancer to treat with. It's very important to raise up the funds in the community, and also bladder cancer surgery, bladder cancer treatment, a lot of time is life-changing and life-saving. It's extremely important to have the community be aware of signs of bladder cancer, seek medical care as soon as possible. Anytime they see blood in the urine or the urine analysis show blood in the urine, that's extremely important, especially for those folks who had exposure of some toxic chemicals in the past, and the long-term smokers.
Just recently, Roswell Park was ranked number 14th in the country for cancer care hospitals. How does that feel for you?
Roswell has been on the top, I would say top 20 for decades. Recently, we have made more progress. We feel very privileged and very lucky to be ranked one of the top cancer hospital in the country. And we're proud to take our patients and to deliver the most updated care.
Dr. Lee, are you a hockey fan?
Unfortunately, not really. I never played hockey. But it's very exciting to watch the hockey. Very, very exciting.
Well, our players and our volunteers in the 11-day power play community work really hard all year to fundraise, to get in shape so that they can physically, play through these long hour shifts that they pursue. Is there one last thing that you'd like to say to them?
Yeah, first thing I would like to thank for them for the huge support for the Roswell Park, and particularly urology department. And we do the prostate screening every year at that key bank. I would say, as far as from the bladder cancer, the most important thing for the community to know is that if you see blood in the urine, or you have recurrent UTIs with the blood in the urine, you need to see a urologist. You cannot assume the blood from the urine is from the infection. You have to see a urologist to make sure you're not dealing with the cancer. One of the things we don't want to see is that the diagnosis was delayed because of multiple treatment, and it may delay the diagnosis and compromise the treatment outcome.
Early detection is key for sure with all cancers. Well, thank you, Dr. Lee, for your time today. Thank you for your incredible work at Roswell Park, and we hope you have a wonderful day.
Thank you so much.